We're at a moment of reform in children's social care. What makes you hopeful and what still concerns you?
I think the thing I'm most hopeful about is under the reform agenda, we've seen much greater clarity on the need for a child protection response to extrafamilial harm than we've ever had before. And that means that hopefully through the reform process, every area should consistently have a child protection pathway for extrafamilial harm. 10 years ago, I just wouldn't have believed that was possible when I was reviewing children's social care records, and they'd be closed to children's services and definitely not on a child protection plan unless there was also harm within the family. So seeing a pathway developed for all children at risk of significant extrafamilial harm, I think is a real opportunity for us to demonstrate, irrespective of harm type, the ability to protect. My biggest worry is about the extent to which we're also going to see that for children in care. Local authorities that I'm working with to implement risk outside of the home child protection pathways are now asking questions about how that applies for children in care. Because once you go into care, you can't be on a child protection plan because the assumption is that you don't need to be on the child protection plan anymore because you're in care. But that's built on the same idea that the risk is at home because you're not at home anymore, so therefore you're not at risk of significant harm. But we know that children in care who are in care due to extrafamilial harm can remain at risk of significant harm while they're in care. And we also know that children who go into care due to challenges within the family can then experience extrafamilial harm while they're in care. And those groups of children at the moment would receive a risk outside of the home child protection plan because they're in care, and we don't have an equivalent. And the Families First Partnership guidance, as it stands at the point of publishing this practice guidance, doesn't give due consideration to how you respond to extrafamilial harm for children in care. The guidance really focuses on child protection. So I have a concern about that, and I feel like much more thought is needed to extend that work.
Yeah, and that's why we're talking about that cohort of children specifically and young people, because we recognise that and we see it in the evidence and the data, don't we? I also think that from a kind of government national perspective, we probably had more focus on the children's social care sector and children's services than since I can ever remember, really. And I guess that all started with the independent care review. And you look at the raft of activity, some of which we might think hits the mark and some of which we might think has further to go. But fundamentally, we've seen commitment and action from government to improve outcomes in a way that we've not seen in a really long time. So I think we're hoping that this work and this practice guidance lands in that context and helps senior leaders in the sector to continue to prioritise serious youth violence, which I think is really positive.